Swadikap and good afternoon. Monday, the 26th of April, 2021 today. Thank you to Dr. Apisamai for the Thai language edition just now. She ended with something very important, is that the basis and the foundation of our work here at the CCSA comes from our intention to most effectively and best serve the people. Now, please take this information with an open mind, an open heart, because of course we welcome all the comments, all the suggestions on how to work better in communicating to the Thai and to the English language audience. But the basis is that we treat all of our audiences as if they were family. That's the basis of our work. That's how much we care about the information that we provide to all of you. Now, when there are fatalities and deaths, and those affected by COVID face a lot of difficulties, we feel for them. We feel for them as well. At the same time, with all the discussions and all the comments and suggestions, be they constructive or not, we will continue our work. We will continue trying to communicate the very best, in our very best possible way, and try our very best to communicate to the people so that we will solve COVID once and for all. And don't forget to please give a lot of moral support to our medical personnel and those in our front lines here in Thailand and around the world. So firstly, I'd like to start off with the numbers that we have for today. New confirmed case for today, 2,048 cases, as you can see on screen. Out of this number, 1,991 cases are from local transmission. So the most part of it is from local transmission, 47 from active case finding, and 10 from within the state quarantine system. There are there are currently 25,767 cases under treatment, active cases at the moment in Thailand, still being treated in the various hospitals, and field hospitals. Now, out of this number of over 25,000 active cases still being treated, we have a tally that 563 are cases of critical condition. So around 563 out of 25,000 in critical condition, and 150 cases are on ventilators. New cases are mostly found to be infected from family members, and we have around 480 persons recorded as new recoveries. The top 5 cases in the country for today, we have Bangkok at 901 cases, Samut Prakan 110 cases, Chonburi 104, Nonthaburi 97, and Chiang Mai 84. So these are the top 5 provinces for today. We have recorded 8 new fatalities, unfortunately, making the cumulative number of fatalities 148. These 8 fatalities, I'll give some information on that, accumulating to 148. So the case 141, a Thai male, 61-year-old from Pathum Thani with diabetes, high blood pressure, and heart disease. Case 142, Thai male, 45 years old from Bangkok, no pre-existing condition. Cause of death is acute kidney failure. Case 143, Thai male, 24 years old from Udon Thani, who had lymphoma. Case 144, Thai male, 92 years old from Chayapum province, who had heart disease. Case 145, Thai male, 63-year-old from Yala province, who had been suffering from chronic kidney disease. Case 146, a Thai female, 52 years old from Bangkok, who was suffering from hyperthyroid and high blood pressure. Case 147, Thai female, 57 years old from Bangkok, and had suffered from spinal disc herniation. Case 148, the last one for today, Thai male, 60 years old, from Bangkok, and suffered from high blood pressure. Now, just some observations from the presentation of Dr. Apisamai just now. There had actually been a large number of clusters popping up around the country in various provinces, in many provinces, except for just a few provinces. Now, we have to be very careful. I'll give some examples of that. So, in Bangkok first, there had been at least 5 small clusters popping up in the past days. And each of those five clusters had at least 50 cases of COVID positive persons. That's in Bangkok. Now, for other provinces, we have, and there you see a map on screen of the sort of like clusters or mini clusters popping up. So we have in Chiang Mai around 179 cases, Udon 70, Korat 71. In Nakhon Phanom, for example, 31 persons in the cluster, also 31 persons in Ayutthaya. So each of the clusters in the various provinces, the numbers are varying, but as you can see on the map on screen right now, it's sort of like kind of wide ranging from provinces in the north down to the south, and also in the central region and Bangkok. However, one piece of information that is about better coordination and integration of work is that now there is a scheme between the different hospitals in Thailand called CoLab. CoLab was a scheme set up by the Department of Medical Sciences, basically to pool the results and to cross-check about various infected cases, cross-checking information about cases between the hospitals. So this is a scheme to strengthen the network of coordination between the medical institutions and hospitals, both private and public. And as I mentioned, it is set up by the Department of Medical Sciences of the Ministry of Public Health of Thailand. One important information which the Ministry of Foreign Affairs had actually clarified last night, was regarding information and news that it was related to the B1617 variant, which was first found in India. Now, this was related to an erroneous translation from a local press agency, from the source news. So, an erroneous translation about Indian nationals taking chartered flights to many countries, including Thailand. So just to clarify here once again that the Ministry of Foreign Affairs and the Civil Aviation Authority of Thailand have confirmed that there was no chartered flight that asked permission, or neither was approved, no chartered flight entering Thailand in the past 2 months. Flights to and from India are only in the form of repatriation flights, which are different, and were scheduled earlier and pre-approved earlier. So Indian and foreign nationals and Thai nationals who have entered Thailand through the past repatriation flights must have obtained the COEs, the certificate of entries, the various work permits, or have been issued with student visas or dependent visas for foreign nationals, and have undergone the strict quarantine period. Now, the CCSA has ordered the halt, the stop, also in the issuance of certificates of entry for foreign nationals who wish to enter Thailand from India. Now, this is, of course, because of the risks involved with the B1617 variant, which was first found in India. So the issuance of COEs, certificate of entries, would now be delayed and halted for those coming from India until further notice. And only Thai nationals will be permitted to board the repatriation flights from India in the month of May 2021. So no COEs for those coming from India for foreign nationals, but for Thai nationals coming on repatriation flights who do not require the various different documents would be able to come from India in the month of May. So only for the Thai nationals. Another piece of information is about the compulsory mask wearing, disease prevention measures through mask wearing. Just to remind that as of today, we have now 48 provinces nationwide, including Bangkok, Chiang Mai, Phuket, Khon Kaen, etc., have imposed the compulsory mask wearing rule in all public places. The list of provinces can be found in the Tourism Authority of Thailand's website, tatnews.org, and violators may be subject to a fine of up to 20,000 baht under the Communicable Disease Act. And you see an infographic there on screen. Just to update you on that infographic, courtesy of the Public Relations Department, just to update you that the number of provinces, as I mentioned, is 48 now, plus Chiang Mai. So on screen it's 47, just to update, last minute update, 48 provinces. Furthermore, starting today, 31 types of venues in Bangkok will be closed or operate in limited hours, as you would have known already. These include cinemas, fitness centers, beauty clinics, sports venues, public parks, among others, and gatherings of more than 20 people are now prohibited for Bangkok. Details of the stricter measures in Bangkok can be found at the Public Relations Department's website, as you see in the slide on screen right now. So we are closely monitoring the situation and evaluating whether further measures would be applied to certain areas where the number of infections have been increasing steadily. The General CCSA meeting, which will be chaired by the Director of the CCSA or the Prime Minister, will be held this coming Thursday to determine on the appropriate measures and to update on any measures necessary according to the situation right now. On patient admission centers, I'll talk briefly about this. The Ministry of Public Health is now setting up a pre-admission center at Hua Mak Stadium in Bangkok. And those who have been diagnosed with COVID will be able to visit the center to receive health checkups and will be assigned with hospital beds accordingly. And you have some images there of that additional facility. This facility aims to reduce the waiting time of patients and prevent them from developing severe conditions. And the Bangkok Metropolitan Administration will also provide more vehicles to transport patients to hospitals or hospitals. And the CCSA, and you have some images there of certain field hospitals around the country. The CCSA aims to provide beds to patients waiting for hospital admission and to sort of like clear the bottleneck out by today. In addition, there had been the creation of more field hospitals with more beds around the country, including in the province of Samut Sakhon. Also, various agencies have been pooling together their resources to create new organizational quarantines. In particular, I'm talking about 14 new organizational quarantines under the arrangement, the joint arrangement of the Thai Border Police, the Thai Immigration Office, and other agencies. So 14 new organizational quarantines. And you have some images there on screen for you. So this is basically the information I have for you for today. I think that it's very important to reiterate about DMHTT, the numbers, hoping that we will all help each other flatten the curve and make the graph have a lower number, less numbers of people infected per day. It depends on all of your cooperation. And of course, together with various sectors of society, I'd like to mention also with the media, with the press, who are very, very important in helping to keep our society safe and COVID-free. Press reports, news reports that are factual, that help us to prevent misinformation are very, very important. Of course, information and disinformation, it comes so quickly. It's very important to double-check all the information that we have, all the information that we're reporting, and remind us and disseminate information which is useful and disseminate information which is factual. A lot of efforts would be necessary to double-check all the information going around on social media in the press. But of course, these efforts are very important, and I'm sure that since we're all on the same team, be it the private sector, the business, media, government, and all sectors of society, all age groups, we're on the same team, hoping that our efforts will bear fruit in the coming days and week, and we'll be able to solve COVID in the near future. Thank you very much for your attention, and we'll see you again tomorrow. สวัสดีครับ
กราบขอบพระคุณค่ะ